Tracheotomy, also known as a tracheostomy, is a surgical procedure where a hole is created in the front of the neck into the windpipe, trachea. This opening, called a tracheostomy or stoma, provides an alternative airway for breathing and is typically done when there is an obstruction in the upper airway or to assist with long-term mechanical ventilation. Here's an overview of how a tracheotomy is performed. Preparation. The patient is positioned comfortably on their back, usually under general anesthesia, to ensure they are unconscious and do not experience pain during the procedure. Neck preparation. The surgical area is cleaned and sterilized to reduce the risk of infection. The neck is often extended and stabilized to allow better access to the trachea. Incision. A horizontal or vertical incision is made in the midline of the neck, just below the Adam's apple, thyroid cartilage, and above the trachea. The size of the incision depends on the patient's anatomy and the specific reason for the tracheotomy. Separating tissues. The underlying tissues are carefully separated to expose the trachea. Muscles and blood vessels may need to be gently pushed aside or clamped to ensure a clear view of the trachea. Creating the tracheal opening. A small incision is made in the front wall of the trachea to create the stoma. A tracheostomy tube, which is a curved hollow tube with a cuff, inflatable balloon, at the end, is inserted into the tracheal opening. The cuff helps to keep the tube in place and to create a seal to prevent air leakage. Securing the tube. The tracheostomy tube is secured in place using ties or straps around the neck. These ties keep the tube from moving and ensure it remains in the proper position. Closing the incision. The surrounding tissues are then carefully sutured together to close the incision. The tracheostomy tube will protrude from the stoma. Post-operative care. After the procedure, the patient is closely monitored in the hospital for any signs of complications. The medical team will provide appropriate care for the tracheostomy tube, including suctioning and maintaining a clear airway. Tracheotomy is a relatively common and safe procedure when performed by experienced medical professionals. It is essential to closely follow post-operative care instructions to minimize the risk of complications and ensure proper healing of the tracheal opening. The length of time a tracheostomy tube is required can vary depending on the patient's condition and the reason for the procedure. In some cases, it may be temporary, while in others, it could be a permanent airway solution.